Lederman, New York's only Harvard-trained, triple-board certified radiation cancer doctor. If chemosurgery or radiation isn't working or isn't tolerated, when cancer and its pain and symptoms aren't getting better, seek a fresh second opinion at Radiosurgery New York's Urgent Cancer Consultants for innovative, custom-tailored cancer treatment. See our experts within one business day because we know your time and your life are precious. Our goal is proper diagnosis and effective, non-invasive outpatient treatment. Decades of leadership, first in New York with brain radiosurgery, first in America with body radiosurgery for cancers of the brain, body, and prostate, all custom-tailored for you. Call 212-CHOICES, 212-CHOICES for a prompt appointment and free booklet DVD. Super convenient, 38th and Broadway, with most insurances, Medicare, Medicaid accepted. You're next at Radiosurgery New York. Just call 212-CHOICES, 212-CHOICES.
You know, cancer, it's not prejudice. It strikes everyone. We've seen the racists with the big C. We've seen humanitarians struck down with the big C. But there are remedies, even if you've already had different measures of treatment, like prior chemo, surgery, or radiation that didn't work. Now, I'm telling you, there's a guy out there who is clearly the best at this. First tryout or second tryout, that's Dr. Gil Lederman. My personal experience in 1991 is he came up with a remedy for my dad. Others had passed on it or just couldn't figure it out. He was able to save my dad's life, and my family will always, always be grateful to him. But look, if you have newly diagnosed and recurrent cancers anywhere in the body, Gil Lederman's the guy to go to. He's a brain and prostate cancer as well as body cancer expert, also treating breast, lung, pancreas, liver, kidney cancers, and more. So, to hit the cancer, you call 212-CHOICES and set up an appointment with Dr. Gil Lederman, 212-CHOICES. Or do it for someone that you know won't do it for themselves. He'll send you an informative booklet DVD in advance, and then you cop a squat with him at his offices at 38th and Broadway. Dr. Gil Lederman takes most insurances, Medicare, and Medicaid. Just call Dr. Gil Lederman for your cancer treatment choices at 212-CHOICES, 212-CHOICES, 212-CHOICES.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WABC studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. Hey, Dr. Lederman, we're back.
Hey, we're back, and we're talking more. We have some news this week, actually. There was an article that looked at robotic surgery versus open surgery for bladder cancer. So we just spoke a few minutes ago about bladder cancer. Well, surgeons obviously, most obviously, like to cut out bladder cancer. We like to hit the cancer and leave the patient alone. But there was a new study that looked at robotic surgery, which is that gizmo, kind of like puppet therapy, where the doctor sits in a studio on a machine and the big machine cuts on the patient remotely. Well, there was a study that looked at open surgery, robotic surgery, compared the two, robotic versus open. And actually a study showed that there was no benefit. So the company that makes the robotic surgery said it's easier, better, there's lights, you can see better, you can do better. But remember, when the robot is in the body, you can't actually feel anything. So normally when a surgeon opens up the body, he has his hands, his fingers, sensation that feels parts of the body and helps prevent damage to healthy tissues. The robot doesn't feel. Yes, it can see things because it has a camera, and it can cut things, but it doesn't feel things. So there was a study done of robotic surgery versus open surgery at a big cancer hospital. What's the downside of robotic surgery? Well, it doesn't feel anything. Often surgeons have very little experience. It's an expensive equipment, $2 million, and the sterile equipment to cover up also costs a lot. So published in New England Journal were doctors that looked at 118 patients with invasive bladder cancer, and they randomized the patients to either the Da Vinci machine or open surgery. Open surgery requires an incision in the abdomen. Da Vinci requires pokes. And then in both arms of the study, the second part of the procedure was trying to make a new bladder out of other tissue, usually of the intestines or other tissue. So people lost that ability to urinate normally. But in fact, the complication rate was the same if you had robotic surgery or open surgery, and the lengths of stay in the hospital was the same. Of course, the company says it's grossly unfair, but in fact it was pretty good surgeons, urologists doing the procedure. Half had one, half had the other treatment, and there was no improvement. And the cost was significantly more with robotic surgery. Of course, we believe the best surgery is no surgery. So you may want to think about what all the options are before you do something, and then we'll talk about it. We had another gentleman who came in with a PSA of 0.071. He's a 66-year-old man, never married, no children, was at the VA, and his PSA was 0.071. It's about the lowest PSA I've ever seen in a normal man. And guess what? They want to do a biopsy on his prostate. Now, I examined the man. His physical exam is normal, and his PSA is super low. So why would anyone ever want to do a biopsy on a man who's got a normal prostate and a low PSA? I mean, normally men who get biopsies have an abnormal PSA or a lump in the prostate. This man had neither. So he came to me, we worked him up, and I said, man, there's no need for a biopsy. Your prostate's normal, your PSA is normal, you're doing great. I don't see any reason for doing a biopsy. He was happy because if you can avoid surgery, you can avoid biopsy, you can avoid anything, it's better to avoid than to have a problem. And that's why it's often good to get a second opinion. So we believe if you want a second opinion, you should come in and meet directly. Sometimes people say, oh, just talk to my doctor and tell him what you think. Well, number one, let's say I called this doctor. The doctor already told the patient, you need a biopsy of the prostate. So the patient doesn't come to me, I don't see him, and I'm supposed to tell the doctor on the phone about a patient who I never saw what he should do? No, it doesn't work that way. A patient needs to come in, we talk to the patient, we review the records, we get everything done, and then the patient decides. The patient is the President of the United States of their own body, and the patient gets to decide. The doctor is not the President of the United States. The patient is the President of the United States, and the patient gets to decide. This patient understood very well. He needed to come in. He came in. He did the right thing. I examined him. I examined his prostate. I got his history, got his documents. He's going to be okay without that biopsy. So a second opinion saved him a procedure, saved him anesthesia, saved him any discomfort that he might have had from a biopsy that I don't think was called for. But another man came in this week from Great Britain, a 47-year-old man. Now listen to this. He's 47. Over the last 3 months, he's had 3 brain operations and a lung operation. They opened up his lung at a hospital in Manhattan, a big hospital, for cancer. He was diagnosed with cancer. Now, the regular listeners to the show know we like to stage the cancer. Where is the cancer? Because cancer, by definition, has the ability to travel or to go places. Well, he had cancer in April at a big hospital. They opened up his chest. Apparently he wasn't staged because 3 weeks later he had seizures. Then they did staging. Then they found brain metastasis, or spread of the cancer to the brain. And then they opened up his brain to remove the tumor. The patient said they did not offer radiation or radiosurgery. He never heard about it. And then, a couple weeks later, they had 2 more tumors in the brain. What would they do? They opened up his head again. He's got an incision from ear to ear. If you imagine an incision going over the top of the head from ear to ear, that's what he had. But that's not the end of it. Then he went to another doctor and had worsening neurologic symptoms, went to another big hospital in Manhattan, and he had his 3rd craniotomy, the 3rd opening of his head in 3 months for removal of brain metastasis. No one ever told him about non-invasive treatment. Can you believe that? In 3 months, 4 operations. Open up his chest first, then his head once, head twice, head 3 times, and he came to me this week, he still has never been staged. No one knows the extent of his cancer. His chemo doctor started chemo, but didn't get him staged. We got him staged. So what did we do? We got a new MRI of the head, which is the most sensitive test for the brain. Then we got a PET scan. All in one day, by the way. Same day. He's been going around since April, May, June, July. No one got him staged. He came to us in one day. We got everything done. His adenocarcinoma of the lung, metastatic to the brain. We found that he has a big mass in the adrenal gland. The adrenal gland is the gland that makes hormones just next to the kidney. That's why it's called the adrenal. Ad means over. Renal means kidney. He has a big mass in the adrenal. We are fortunate that we're able to use stereotactic radiosurgery, non-invasive treatment to treat the adrenal gland. We're able to treat the brain. He started treatment this week. He's doing better. You can imagine what a blow 4 operations in such a short period of time is. We've staged him up, and most likely he's going to respond very well to focused beam treatment for the brain metastasis. Our success rate where we hit is 90%. For the adrenal is 90%. This is for adenocarcinoma of the lung. We have the ability to treat cancer anywhere. He is happy that hopefully this nightmare of 4 operations in 3 months is over now that he's learned about non-invasive treatment for lung cancer. So he has stage 4, and he's getting better. Even this week he looks better. He looked better on Friday compared to when he first came in earlier in the week, I believe, because he's getting under the dark cloud of surgery. Non-invasive treatment is well tolerated. He comes in with 2 friends who are very supportive of him, and he's got a new approach which makes him happy and his friends happy. This is certainly better than what they were talking about before, which was hospice. So, this is Dr. Lederman from Radiosurgery New York. We're going to hear from a few voices, and then we'll be right back. If you have questions, call us at 212-CHOICES, 212-246-4237.
For cancer treatment, most prefer effective, non-invasive, well-tolerated outpatient therapy. With Dr. Lederman, the radiosurgery pioneer, that's our goal, too. He's first in America, first in New York, first for you with body radiosurgery. We hit your cancer with no cutting, no bleeding. Dr. Lederman has decades of experience with primary and metastatic large or small cancers from head to toe. Cancer treatment with possibly a second chance for you, even if chemo, radiation, or surgery didn't work or isn't tolerated. Our goals are best results and quality of life. Meet Dr. Lederman to hit the cancer. For a free booklet DVD, call 212-CHOICES, 212-CHOICES for a fresh second opinion. Most insurances, Medicare, Medicaid, accepted. Not only super convenient, super. Broadway and 38th in Manhattan. To hit your cancer, see Dr. Lederman, 212-CHOICES.
With Dr. Lederman, the best prostate cancer treatment is custom tailored for you. Each man with prostate cancer is unique and seeks the best results based upon PSA, Gleason score, and stage. That's why Dr. Lederman's custom tailored prostate cancer treatment is most logical. Not every man should get the same treatment. Dr. Lederman's custom prostate cancer treatment is all outpatient. Our goals are your best results, avoiding radical surgery, maintaining your sexual and urinary function, and your life.